Did you know that your baby's position is not random? It's based on the space that's available for them in the uterus. And the uterine ligaments can really influence the shape of your uterus, which can then influence what position your baby can be in. In this video, we're going to break down exercises that you can do to release tension in the uterine ligaments to support optimal uterine positioning for the best position for your baby. Welcome to the Mamas Who Fit YouTube channel. My name is Gina. I'm a perinatal fitness trainer and birth doula, and I am pregnant with my fourth baby. And so I want to share with you exercises that I'm doing during my pregnancy to help support uterine balance to support my baby's position. But before we dive into this video's exercises, I want to share that our new book, Training for Two, is now available for pre-order. This book is going to explain to you how you can use prenatal fitness to support not only a strong pregnancy, a pain-free pregnancy, because pain is not a requirement of pregnancy, but also how you can create more space in your pelvis to support your baby and your birth. You can grab the book for pre-order now, and it comes out in September. The uterus has several ligaments that attach it to surrounding structures. We have the round ligaments here on the front side, in addition to the broad ligament, and we have the uterosacral ligaments here down on the bottom. The round ligament attach from the front of the uterus down to the labia, so you may experience something called lightning crotch if you have round ligament pain, because they do attach deep in the vagina. With the round ligaments, you may also feel sudden sharp pain to one side of your lower abdomen, especially with hip extension or even walking when you're extending in your hip. If one round ligament is a little bit tighter than the other, it can kind of pull the uterus towards one side as well, which can change the shape of the uterus, influencing how your baby can be positioned. Across the front of the uterus, we have the broad ligament, and this ligament is going to help support the uterine position front to back. With the broad ligament, if it's really tight, it can kind of pull inwards and create this inward speed bump, which could influence how well your baby can move down into your pelvis. If the broad ligament is on the tighter side, your baby's movements and kicks can be really painful. On the bottom of the uterus, we have the uterosacral ligaments. These attach from the bottom of the uterus to the sacrum, or that triangular bone on the back side of the pelvis. If these ligaments are on the tighter side, they can kind of twist and torque the bottom of the uterus, decreasing space, which can influence your baby's ability to get into a head-down position. So let's break down a few exercises that you can do to help release tension in these ligaments to support optimal positions for your baby. The first exercise that you can do is the forward-leaning inversion. In the forward-leaning inversion, we're helping to release tension in the vertical running ligaments, so our round ligaments, but especially the uterosacral ligaments. So starting in an elevated position, either on a couch or I'm using a workout bench here, I'm going to come all the way down to my forearms. I'm going to take 3 breaths there. So I'm going to bring my hands to the edge of my elevated surface and then walk my hands down to the floor, bringing the forearms down and then tucking my chin here. I'm going to take 3 full breaths, focusing on relaxing in my lower body. And then when I'm done, I'm going to extend in my arms, bring my hands back to the elevated surface, and then fully extend in my hip to kind of rest here, kind of regain myself before I step off. If you're down in the forward-leaning inversion and you begin to feel really uncomfortable or lightheaded, you can also just walk forward and crawl off the bench and then come to a seated position until you feel better as well. In the forward-leaning inversion, you should feel a stretch happening in the sacral area or even in the low back, and potentially in the round ligaments as well. Another exercise that you can do for the round ligaments is going to be the 90-90 side camel. So one reason that one round ligament may get a little bit tight is that you may be more compressed towards one side. And so we can first add in a side body opener to help stretch through that side body to release tension. And then we can place the hand behind us to fully extend in the hip to feel a big hip flexor stretch, because this is the general area that the round ligament is in as well. So come to find the side body opener to release side body compression that may be influenced round ligament tension. And then placing the hand behind you to find a release to that hip flexor to release tension in the general area that the round ligament is in. The final exercise that you can do to help support the broad ligament and also to release some of the uterosacral is going to be an all-fours hip shift. So in the all-fours hip shift, you're going to place one knee onto an elevated surface, such as a yoga block, and then you're going to shift the weight over towards that elevated knee. From here, you should feel a big stretch in this glute. And the way that you know that you've shifted over is if you lift the lower knee, your body position does not change. If you have not shifted your weight to the elevated hip, If you try to lift the lower knee, your whole body will have to shift in order to keep your balance. So shift the weight over towards that elevated hip. And then from here, I'm going to exhale to round in my back as I pull my belly to spine. When I engage in my abdominal muscles, it's helping to support the broad ligament and helping it to release tension. And then I'm going to drop the belly down to the floor, feeling a stretch through my back, and then round in my back, pull belly to spine. As you move through this movement, you should feel a stretch happening through like the glute musculature, almost as if your pelvis is rotating on top of that femur. And so this is going to help to release tension in that posterior pelvic floor of the elevated hip, which can potentially release some tension in the uterosacral ligaments. And by exhaling to engage in the abdominals when you round, it's helping to support the front side of the uterus to help release tension in that broad ligament. So you can move through about 10 pelvic tilts on one side, and then switch the block to the other side, shift the weight over, and then do the same thing towards the opposite side. After about halfway through your pregnancy, you can begin to incorporate these uterine release exercises multiple times during the week. So you can aim for about 2 to 3 times each week to help release tension in the uterine ligaments to help support your baby's position. If you want daily workouts to support you throughout your pregnancy so you can have a strong and pain-free pregnancy as you prepare for birth by releasing tension in the uterine ligaments, releasing tension in your pelvic floor, and ensuring that you can open each pelvic level, join our online prenatal fitness programs. We offer our prenatal fitness programs in an app, which is the Team Builder app, which is a self-paced workout, both long version and short version of the workout, or is an on-demand program where it's full-length workout videos that you can follow as you work out at the same time. You can check out all of our fitness programs on our website at mamastayfit.com and use code YouTube10 to get 10% off any of our online offerings. If you enjoy this video, be sure to like and subscribe to our channel and comment below what other aches and pains you may be having during your pregnancy so we can make a workout video to help support you.